Hello, I'm Zach Comer and welcome back to our video training series on how to identify and treat structural dysfunctions that are often the root source of our clients' pains. In this video, we're going to focus on getting a nice understanding of what are these root causes, what are these structural dysfunctions, and how are they root causes of pain that are different from what our normal focus is when it comes to pain treatment in our clinics. So let's start with what's common, what's normal. The easiest description would be just to say trigger points, right? Active trigger points that are causing localized pain and or referral patterns of pain. We could talk a little bit more broadly than trigger points in terms of the things that our clients come to us for. Hypertonicity throughout various soft tissue regions, that with or without active trigger points, there may be a sense of achiness, obviously stiffness, and just limitations with how folks move that are significant enough to bring them into our offices for treatment. So just for simplicity's sake, I'm going to just refer to it all in that category as trigger points, and going to differentiate trigger points as being a source of pain from what the Hesh method is focused on treating. So what we focus on with the Hesh method is treating the deep fascia and most dense connective tissue in and around the joints themselves. So whereas trigger points are going to typically be in muscle bellies, right? That could be adjacent sometimes to joints, but generally trigger points are going to be in muscle bellies. We can access trigger points by treating the tissues directly with direct pressure into those soft tissues, the fascia, muscle bellies, etc. in that area. With deep joint and dense connective tissue around the joints, we can't get in there in the same way with direct access to those tissues. So just think about what all these tissues may be in there around the joint. If we use the hip joint as an example, we've got at the deepest level, the hard tissues would be the bones themselves, like the head of the femur and the acetabulum. We've got the hip capsule that holds those two together in addition to the dense ligaments there. We've got the tendons attaching in this region. We've got the working our way out more superficially. Now we've got muscles that may be, some of them may be hip joint muscles themselves or muscles that cross over that area that aren't the hip joint themselves, but are still going to be intertwined from a fascial perspective. And then we've got the fascia itself working its way through those muscles into those tendons, ligaments, cartilage, and bones as well, ultimately going all the way down into the bones themselves. So the deeper in there you get, the denser that junction is, and the less accessible it is through our normal treatment methods. So one thing to understand is that we can't access it through our normal methods. In a separate video, we're going to talk about the methods that we'll use and the principles behind those methods for treatment. But sticking with the focus in this video on this deep fascia as the source, as one of the root sources of chronic pain in many cases, we need to understand next how it causes pain. So we've got the restriction in the deep fascia, and what that restriction is going to do is block micro motions of the joints. Now these micro motions, I want you to think of them as the essential building blocks for all the larger motions that happen, that are usually what we'll be assessing if we're assessing movement and range of motion. A simple example would be the hip joint with flexion and extension. So my forearm here is going to represent the femur, and the hand on top is going to represent the acetabulum. This direction is going to represent hip flexion, and this is going to represent hip extension. So there's the larger gross motion, extension and flexion. But notice what's happening up here at the top as we go into hip flexion, we have at the head of the femur a little bit of posterior glide in the joint in order for that motion to happen the way it's designed to. As we go into hip extension, we have an forward or anterior glide in the joint. Now, what happens if this little bit of subtle gliding movement becomes restricted, then it's not going to stop it's not going to stop extension and flexion in its totality, but it's going to throw off the coordination of those movements in such a way that we're going to have certain muscles that are overactive and other muscles that are underactive. The consequence of that over time is oftentimes going to be those hypertonicities developing in the tissues to the point of having active pain-causing trigger points. While those trigger points may be the most direct source of pain as far as where is the pain emanating from, what's causing them, what's leading up to their formation, and the fact that they stay in the system for as long as they oftentimes do, is the restriction in those micro motions. And that restriction is caused by the deep joint fascia and deep dense connective tissue around the joint being so, we can call it locked up, but let's understand that at a little bit more nuanced level as well. What's causing the locking up of those tissues right there in and around the joint spaces themselves? This is going to be a little bit more theory, perhaps, than everything else I've explained to you so far, because it's hard to know for sure, like what exactly is causing it. But most likely, in many cases, if not all cases, it's a result of guarding of that joint, a protective guarding, a signal from the nervous system to protect that joint. Why? Maybe there was a previous injury to that joint. Maybe there's just repetitive strain and stress from poor postural habits or from repetitive motions and movements that our clients do on a regular basis that are putting excessive strain on that joint. But if you just boil it down, what we need to understand is that there's a locking down of these tissues, probably caused by the nervous system. It restricts the micromotion. Once the micromotion's restricted, the larger motions are not able to function as designed, so you get certain muscles overworking to create those motions and other muscles that just get inhibited by the overactivity, perhaps, of certain muscles. And all of that can stack itself up to the point where now we have these trigger points that are active, that are what we're oftentimes treating as the best that we can do until we know better, until we know that where else to look in the system. So that's going to sum it up for now in terms of our basic understanding of deep joint fascia and dense connective tissue around the joint as the focus of our treatment. So we're switching our focus from trigger points to deep joint fascia. And in the subsequent videos, I'm excited to share with you how we're going to assess the deep joint fascia and these micro motions to see if they're restricted to the point of needing treatment. And then from there, we'll move on to talking about principles of treatment and then giving some demonstrations as well. So I hope you've enjoyed this video, and I look forward to sharing more with you in the ones to come.